I study the CFTR, the cystic fibrosis causing gene CFTR. Mutations in this gene, or faults in the CFTR, can lead to this deadly illness. Cystic fibrosis is the most common fatal genetic disease affecting young Canadians, with over 70,000 people affected worldwide. The median age of survival for these patients is approximately 50 years young, and 90% of them will die from end-stage lung failure. Patients have a thick, putty-like mucus that accumulates around their lungs, so when dangerous bacteria enter, they tend to stick around for a very long time, whereas a healthy person's immune system can fight this off right away. As a result, patients harbor dangerous bacteria that is only contagious to other patients and not healthy individuals. Due to this cross-contamination risk, patients are advised to be no closer than 6 feet apart. Imagine being diagnosed with a terminal disease and not being able to interact with other people like you in person. There is a medication designed to help correct the most common cause of cystic fibrosis. However, it is fairly inaccessible in Canada due to its outrageously high price of $250,000 per patient per year. For my research, I want to examine the CFTR interaction network and see how it changes upon mutation and exposure to current frontline therapies. I want you to think of these networks as a human social network. When I'm interacting with my normal group of friends, I'm happy. However, if one of these friendships or interactors were to change, I may begin to express different emotions such as sadness or anger. This is the same for CFTR. When CFTR associates with a number of different proteins or friends, some of these friends can actually change upon mutation. So just as I experience sadness upon the loss of a friendship, CFTR experiences symptoms of the disease cystic fibrosis. Here's an example of a map that I have generated for CFTR. We have CFTR in red, and surrounding it are all of its friends. I want to see which of these friends change when I mutate the gene and add drugs. The blue friends are friends that potentially are lost when CFTR is mutated. I want to see if any of these friendships can be restored with drug treatment. This way, mutant CFTR can have the same posse that it does in its normal state. Despite extensive research, there are significant gaps in our understanding of who CFTR is interacting with. We know that CFTR associates with so many friends, but how these friendships are changing in cystic fibrosis is very poor. My research is crucial because I want to understand how this network changes because it can provide insight on how we can better treat this disease. Hopefully in the near future, patients with cystic fibrosis won't have to worry about getting the drugs that they need. Thank you.